What is rheumatoid arthritis? Rheumatoid arthritis, RA, is an autoimmune disease that is chronic, ongoing. It occurs in the joints on both sides of your body, which makes it different from other types of arthritis. You may have symptoms of pain and inflammation in your 1. Fingers, 2. Hands, 3. Wrists, 4. Knees, 5. Ankles, 6. Feet, 7. Toes. Uncontrolled inflammation damages cartilage, which normally acts as a shock absorber in your joints. In time, this can deform your joints. Eventually, your bone itself erodes. This can lead to the fusion of your joint, an effort of your body to protect itself from constant irritation. Specific cells in your immune system, your body's infection-fighting system, aid this process. These substances are produced in your joints but also circulate and cause symptoms throughout your body. In addition to affecting your joints, rheumatoid arthritis sometimes affects other parts of your body, including your 1. Skin, 2. Eyes, 3. Mouth, 4. Lungs, 5. Heart. Who gets rheumatoid arthritis? Rheumatoid arthritis affects more than 1.3 million people in the United States. It's 2.5 times more common in people designated female at birth than in people designated male at birth. What's the age of onset for rheumatoid arthritis? RA usually starts to develop between the ages of 30 and 60. But anyone can develop rheumatoid arthritis. In children and young adults, usually between the ages of 16 and 40, it's called young onset rheumatoid arthritis, YORA. In people who develop symptoms after they turn 60, it's called later onset rheumatoid arthritis, LORA. Symptoms and causes. What are the symptoms of rheumatoid arthritis? Rheumatoid arthritis affects everyone differently. In some people, joint symptoms develop over several years. In other people, rheumatoid arthritis symptoms progress rapidly. Many people have time with symptoms, flares, and then time with no symptoms, remission. Symptoms of rheumatoid arthritis include 1. Pain, swelling, stiffness and tenderness in more than one joint. 2. Stiffness, especially in the morning or after sitting for long periods. 3. Pain and stiffness in the same joints on both sides of your body. 4. Fatigue, extreme tiredness. 5. Weakness. 6. Fever. Does rheumatoid arthritis cause fatigue? Everyone's experience of rheumatoid arthritis is a little different. But many people with RA say that fatigue is among the worst symptoms of the disease. Living with chronic pain can be exhausting. And fatigue can make it more difficult to manage your pain. It's important to pay attention to your body and take breaks before you get too tired. What are rheumatoid arthritis flare symptoms? The symptoms of a rheumatoid arthritis flare aren't much different from the symptoms of rheumatoid arthritis. But people with RA have ups and downs. A flare is a time when you have significant symptoms after feeling better for a while. With treatment, you'll likely have periods of time when you feel better. Then, stress, changes in weather, certain foods or infections trigger a period of increased disease activity. Although you can't prevent flares altogether, there are steps you can take to help you manage them. It might help to write your symptoms down every day in a journal, along with what's going on in your life. Share this journal with your rheumatologist, who may help you identify triggers. Then you can work to manage those triggers. Biologics tend to work rapidly, within 2 to 6 weeks. Your provider may prescribe them alone or in combination with a DMARD like methotrexate. What is the safest drug for rheumatoid arthritis? The safest drug for rheumatoid arthritis is one that gives you the most benefit with the least amount of negative side effects. This varies depending on your health history and the severity of your RA symptoms. Your healthcare provider will work with you to develop a treatment program. The drugs your healthcare provider prescribes will match the seriousness of your condition. It's important to meet with your healthcare provider regularly. They'll watch for any side effects and change your treatment, if necessary. Your healthcare provider may order tests to determine how effective your treatment is and if you have any side effects. Will changing my diet help my rheumatoid arthritis? When combined with the treatments and medications your provider recommends, changes in diet may help reduce inflammation and other symptoms of RA. But it won't cure you. You can talk with your doctor about adding good fats and minimizing bad fats, salt and processed carbohydrates. No herbal or nutritional supplements, like collagen, can cure rheumatoid arthritis. These dietary changes are safer and most successful when monitored by your rheumatologist. But there are lifestyle changes you can make that may help relieve your symptoms. Your rheumatologist may recommend weight loss to reduce stress on inflamed joints. People with rheumatoid arthritis also have a higher risk of coronary artery disease. High blood cholesterol, a risk factor for coronary artery disease, can respond to changes in diet. A nutritionist can recommend specific foods to eat or avoid to reach a desirable cholesterol level. When is surgery used to treat rheumatoid arthritis? Surgery may be an option to restore function to severely damaged joints. Your provider may also recommend surgery if your pain isn't controlled with medication. Surgeries that treat RA include 1. Knee replacement. 2. Hip replacement. 3. Other surgeries to correct a deformity.